Good morning! In this video, you will watch the discussion of the model for nursing, which is a work collaboration of Nancy Roper, Winifred Logan, and Alison Tierney. Let's start with a short background of the three. Nancy Roper was born on September 19, 1918, in Wetherell, Cumberland and died on October 5, 2004. She studied to be a nurse in Manchester and then carried out her general training at Leeds General. Roper's model of nursing was originally published in 1976 and revised in 1985 and 1990. The most recent revision occurred in 1998. Winifred Logan was born on May 9, 1931. In 1960s, she got her master's degree in Columbia University, New York. She also became a WHO consultant as Executive Director of International Council of Nurses. With her interests in conceptual model of nursing, she didn't hesitate to accept the invitation of Roper to develop a nursing model based on model of living. Alison Tierney is Editor-in-Chief of Journal of Advanced Nursing, which is an international journal that publishes research and scholarly work across the breadth of nursing and midwifery, and that it is in the top 10 nursing journals worldwide. The 5 components in the model are activities of living, factors influencing activities of living, lifespan continuum, dependence and independence, and individuality in living. In the activities of living, the current model seeks to define what living means and categorizes these discoveries into activities of daily living. The factors influencing activities of living are biological, psychological, sociocultural, and environmental. The model also incorporates a lifespan continuum, where the individual passes from fully dependent at birth to fully independent in the midlife and returns to fully dependent in their old age or after death. Fourth, the dependence and independence. This component of the model is closely related to the lifespan and to the ALs. It is included to acknowledge that there are stages of the lifespan when a person cannot yet, or for various reasons can no longer perform certain ALs independently. Individuality in living. Each individual will experience and carry out the ALs differently. Each person's individuality in carrying out the ALs in part determined by stage in the lifespan and degree of dependence and independence, and is further fashioned by the influence of various biological, psychological, sociocultural, environmental, and political-economic factors. The Roper-Logan-Tierney model for nursing is a theory of nursing care based on activities of daily living, which are often abbreviated ADLs or ALs. The model is widespread in the United Kingdom, especially in the public sector. The purpose of the theory is as an assessment used throughout the patient's care. In the United Kingdom, where the model is prevalent, it has been reduced to being used simply as a checklist. It is often used to assess how the life of a patient is changed due to illness, injury, or admission to a hospital. The nurse uses the model to assess the patient's relative independence and potential for independence in the activities of daily living. This helps the nurse determine what interventions will lead to increased independence. Critique. It is only a snapshot and is often not referred to after the initial assessment or updated. It is only one among several nursing assessment tools: Waterlow, moving and handling, nutrition, pain, etc., in addition to other medical. The patients may not be consulted, empowered to cooperate, or compliant in their care. Patient care is fragmented task nursing rather than holistic nursing. It is a paperwork that takes nurses away from hands-on care. Thank you for listening.
Next theorist we're going to discuss is Dr. Arceli Balabagno. She took her bachelor's degree in nursing at FAU Manila, year 1967, and masteral and doctorate degree at the University of the Philippines. She is awarded as the 1995 Most Outstanding Teacher in UPM. Dr. Balabagno was also given an Ethiopian plaque of recognition for extension services to the PGH Central EKG Station and Service Award for 30 years of loyal service to the University of the Philippines Manila campus. Functional health performance outcomes of compliance to home instruction program after myocardial infarction is one of her most known research that has a goal of determining the functional health performance outcomes of myocardial patient on compliance to home. Some of the objectives of the study are to determine the functional health performance outcomes of myocardial infarction clients on compliance to home instruction program. To determine the relationship between and among following variables: age, marital status, years of education, occupation, family structure, ethnic background, type of myocardial infarction, number of cardiac drugs, and compliance to home instruction program, and functional health performance. To describe the dynamics accounting for successful adherence to home instruction program, to describe the experiences of nurses providing home instruction program to clients after myocardial infarction. During their transition from hospital to the home setting, clients had expressed need for care because of overwhelming experience brought about by the physical, physiologic, psychosocial, and emotional effects of myocardial infarction. The intervention was based on concepts of interaction, goal setting, and information support. Increase in the quality of interaction between the client, the nurse, and significant others may successfully enhance adjustment and recovery.